This is Justine Spargo recording Health Promotions for chapters 12 and 27. All right, so our objectives for this PowerPoint would be to define health promotions, define health protection, review nursing health promotion assessment, identify common interventions for health promotion, define stress, categories of stress and coping strategies, discuss general adaptation syndrome and its stages, and identify interventions for de-stressing. So what is health? So the WHO, or the World Health Organization, basically states it's a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity. So the World Health Organization also says that health promotion is the process of equipping people to have control over and to improve physical, emotional, and social health. So it's one way to help improve. So what is health? So Jean Watson, her definition was basically saying that high overall functioning is a state of mind. An example from the book is that a person may have a terminal illness and yet consider himself completely healthy. Now, Betty Newman, she had the continuum of energy, or an expression of living energy available to an individual. High energy is wellness and low energy is illness. When more energy is generated than expended, there's wellness, and when more energy is expended than generated, there's an illness or possibly death. Now, Myers, Sweeney, Whitmer, and Whitmer said basically an integration of mind, body, and spirit is what health is, and those with disease can still be healthy. Now, health protection. So health promotion is the desire to increase well-being. Now, health protection is motivated by the desire to avoid an illness. So health prevention has different levels of activity for prevention. So the first one's primary, which are basically activities to prevent or slow the onset of a disease. So some examples are eating healthy foods, exercising, wearing sunscreen, and wearing your seatbelt when you're in your vehicle. Now, there's secondary, which is screening activities and education for detecting illnesses in early stages. Some examples of those would be like breast self-exams, testicular exams, or regular physical exams every year. And then tertiary is stopping the progression of a disease or getting the individual's health to pre-illness state. So this could be considered the rehabilitation level if you want to think of it that way. Health promotion, like I said, is motivated by the desire to increase well-being. So it's related to an individual's lifestyle choices, such as tobacco use, or alcohol use or illicit drug use, exercise, or teen pregnancy. So one way the U.S. has come up with a way to help create wellness for groups or individuals by creating the Healthy People 2020. I'm not sure if it's going to be called Healthy People 2030 or Healthy People 2040 this next year, but we're still on Healthy People 2020. So it's got a national initiative. It addresses the effects of lifestyles on health. And it's created health improvement goals and then updates them every year. So it keeps track of everything to see how the United States is doing in general. And then it's ultimately there to also help eliminate health disparities. So there's different health promotion models depending on, who you kind of talk to. So Pender's health promotion model has 3 groups of variables that affect health promotion. So individual characteristics and experiences, behavior-specific cognitions, and then effect and behavioral outcomes. So that's what he looks at. Now, there's the wheels of wellness, and this theory is that if one of the spokes of this wheel that you see here in your picture is weak, the whole wheel is weak. So each of the spokes of the health wheel represents dimensions of health. So as you can see, they're emotional, intellectual, physical, spiritual, social or family, and then occupational. So think of it as you're riding your pedal bike, and if one of those spokes is broken, then your wheel becomes weaker and could actually collapse in on itself. And so the thought is for that it's true in this case as well. Now, there is a model of change, which has 6 stages. It's pre-contemplation, contemplation, preparation, action, maintenance, and termination. So pre-contemplation is that there's no intention or change to the behavior. Now, contemplation is the person's thinking about overcoming the problem, but not any commitments yet. Preparation is intending to take action, and then action is a plan is implemented and there's actual commitment. And then maintenance is working to prevent the relapse. And then termination is having changed the behavior completely. A person may progress or regress, just like someone who is trying to quit smoking. So they may get all the way through this phase in termination, and then they may regress and have to start over in the contemplation phase or preparation phase again. So they can go back and forth on that. Health promotion programs. So disseminating information, basically people need information that they can be at an individual level or group level in classes or community level on billboards, internet, health fairs. So they need information. Those are all ways that they can get them in different forms and different levels. Changing lifestyles and behaviors, usually at a group level is when this is done, and this provides information and offers support at that point. Now there's protecting the environment. It's environmental control programs that focus on like air, water, toxic waste, healthy outcomes, things like that. And then there's wellness assessment or health risk appraisal. This is like a wellness assessment, focuses on healthy behaviors, and health risk appraisal identifies risky behaviors that promote disease. And sometimes we see these used for like life insurance policies where you may have to go in and have a checkup to prove that you're healthy, and then they determine how much money it's going to cost for your health insurance. So that's kind of how they go on that. Again, health promotion program settings. So different settings that we see these all take forms can be health facilities, like hospitals, clinics, things like that. Work sites, things can be done at the work sites. Schools, by educating kids and showing them things or how to give injections themselves, especially if they're diabetics, things like that. We already talked about the physician's office, health clinics, hospitals, and then in community settings. So think about those county nurses that do a lot of that. So nursing assessment. So health history, physical examination basically is a thorough health history, review of the body systems, and physical examination, just as it sounds. So a lot of times we ask about family history, causes of death, check vital signs. We may weigh the patient, check their waist circumference, auscultate and palpate, inspect skin, check their pulses. Sometimes it includes lab work or other disease-specific studies. Okay, so it's just that it's um, part of the physical examination. Now we can also look at physical fitness and go further into detail on that, like cardiorespiratory fitness, which checks large muscles to perform moderate to high intensity exercises for long periods of time. There could be just muscular fitness, which tests muscle strength and endurance. And then we can also check flexibility, which is like that range of motion, which usually assesses lower back and hip trunk flexion. All right, lifestyle and risk appraisal. We look at those personal habits the patient may have, recreational activities, their occupation, activities that promote optimal living. Health risk appraisal tools evaluate risk for disease based on current demographics, date, lifestyles, and healthy behaviors. And that's something that I'll have you end up doing for one of your assignments as well. So we'll talk about that a little bit more in detail later. Life stress review. So we look at stress triggers, psychological response that may over time induce illnesses. So stress is basically inducing life changes, gives you a high score on this life change event scale, and associated with a greater likelihood of negative health change. The more stress, the more likely to experience a disruption in health. And again, this will be on your health promotion plan, and we'll go through it more in depth in class. Now we have the hardiness versus vulnerability that we can also be looking at. And hardiness is a quality in which an individual experiences high levels of stress, yet doesn't fall ill. Sometimes it's also called grit. You may hear it called that. There are three characteristics to a hardy person. So there's control, so they have control over experience. There's commitment, so feeling involved in the activity producing the stress, and then challenge. They may view whatever the stress is as a challenge to help them change and to grow and gain something from that experience. And then we can also look at health beliefs for our patients. That includes cultural beliefs and personal experiences. So I want you to think why it's important for you to respect cultural and religious views while working with clients to adopt personal health goals. So I know that sometimes we need to respect those because they are firm believers that if they, for example, pray to God every night, that their prayers will be answered and things will get better. They're very spiritual and things. And sometimes that's what gets them through and helps them to become hardy as well. So we also need to take a deep consideration for our health beliefs. And if we don't understand them, take the time to do some research and understand. So that way we can help our patients in the best way possible. Because that's what we're here for, is our patients. Now, we may also do a nutritional assessment, which is a key component of an overall wellness assessment. So we can look at dietary patterns, we can look at body mass, which is a pattern of body fat distribution. And it's a lot of times a predictor of health risk. So fat around the trunk and abdominal area gives you a higher incidence of metabolic syndrome and hypertension and hyperlipidemia, heart disease, type 2 diabetes, and premature death. So we know that happens. So looking at your dietary patterns will help give us better indicators for longevity. Then we have health screening, which is a secondary prevention activity to help diagnose specific diseases at an earlier stage. So that's like blood pressure screening, cancer screening tests, laboratory studies, like having lipid levels or a PSA done. And a lot of times these are part of your usual care that you go in and have your routine care for your annual checks done. Nursing interventions for health promotion. So role modeling. So teaches by examples is basically what that is. The nurses serve as role models. So imagine the trust a client loses when he finds out that a nurse who tells him not to smoke cigarettes has a 2-pack per day habit. Well, that's not going to resonate very well with that patient. You're telling me to quit smoking, but yet you're not stopping smoking. Don't tell me what to do. So we need to lead by examples. I'm sure you can come up with other ways of role modeling as well, which we could discuss in class later. Counseling, this can be done one-to-one individual. It can be done by telephone, and it can be done online. However, there are some disadvantages to telephone and online. And a lot of that stems to the nonverbal communication. Okay, so like if I have to do a health coaching call as part of my job to get a lower rate on my insurance, and I have to do this health coaching call where I call someone and set up an appointment, and they ask me how my eating habits are and give me recommendations on how to eat more healthy and tell me to eat fruits and vegetables. I may say, yep, okay, I'm all for that, let's do it and everything, but I could be sitting on the other end of the phone rolling my eyes with my eyes crossed going, yep, sure, yep, and it's not making an impact. So that's the disadvantage of telephone or online. But there's also an upside. People may tell you more because they're not facing you one-on-one. So there could be upsides of that as well. Now, health education is also part of an intervention. Self-care programs or caregiver education programs. As nurses, we're constantly educating and trying to help our patients make the best decisions for themselves. We also need to be supporting lifestyle changes. So as nurses, we should be familiar with different programs offered in our local communities. So that way we know what to offer our patients. And so then we can speak highly of it, or at least have someone that can come in and talk to them. A lot of times it's our social workers who know everything about what's offered in our communities. What is stress? All right, so we're moving on to stress now. So stress is any disturbance in a person's normal balanced state. So everyone's got unique response by which each person responds to a stressor. A stressor is a stimulus that a person perceives as a challenge or physical or emotional threat. So they perceive it as a threat. Doesn't mean that it's a threat, but they're perceived as a threat. Um, can be harmful or it can be motivating. Stress can be. It can keep you alert and motivated to run away from a bear, but too much stress can cause you to be anxious and you can't focus clearly, or you can't focus on a certain task at hand. If you're stressed all the time, you might run into a tree or trip instead of running away from that bear and fall and get caught by the bear. So we don't want to be stressed all the time. So categories of stress. So distress can threaten health. Eustress is good stress and is protective, like running away from that bear. Developmental are associated with like life changes. So when kids are getting ready to be potty trained, they might be scared or stressed out about it, or going to school could be stressful or things like that. That would be developmental stages. And then adolescence, um, in front of their peers or friends could be like another developmental stressor. There's also situational, which is unpredictable, such as having a car accident or a tornado ruin your car. There's also time, which is considered part of the time management, like not having enough time to do homework, spend time with your kids, work full time, cook supper, attend kids' extracurricular activities. There's only so much time in a day. There's anticipatory stress, which is future events such as like finals, like starting to get worried and stressed out about finals, even though it's five five weeks away or whatever. Psychological actually affects the body structure and function. So it can be chemical, physical, mechanical, nutritional, biological, genetic, or lifestyle. And then there's psychosocial, which is external stressors that arise from everyday life events like family dynamics, work or living situations, or like financial strains. So there's different styles of actually coping. So we call them coping strategies. So there's adaptive, which coping is effective. We make healthy choices that reduce the negative effects of the stress. And then those healthy choices directly reduce negative effects of stress. Examples can be like a change in lifestyle, problem solving, exercise, having hobbies, talking to someone. I'm sure you can think of many more. And then we have maladaptive, which coping does not promote adaptation and is unhealthful. So it's an unhealthy style, a temporary fix sometimes. It's possible other harmful effects can occur from it. Some examples there would be like substance abuse, overeating, or oversleeping. I know when I get super stressed, I turn to chocolate. So that may, you know, lead to overeating, or when I feel kind of depressed, situational depression, may oversleep. I want to sleep all the time. Or like some of you may not know, my first husband passed away from cancer. And so I didn't realize it at the time, but I drank a lot after he passed away because that's the only time that I could cry. And so I turned to alcohol at that time. I didn't know it. And now I can look back and say, yeah, that was a maladaptive approach, but that's what I did. And thankfully, I was able to work it out, and I had some people to help me make it through the hard times. But that's a maladaptive approach, and you will see that. So dealing with stress, coping strategies continued. So there are three general approaches for coping, depending on the situation. You can alter the stressor, which actions are to remove or change the stressor. We can adapt to the stressor, so changing thoughts or behaviors related to the stressor, or we can avoid the stressor. sometimes healthful, but in other situations, it's maladaptive. Like, I had a family friend who thought that he was dying and he was having lots of chest pain and he thought he had cancer and he didn't say anything to his wife, didn't go to the doctor or anything until basically he was having a massive heart attack and had a quadruple bypass. His wife finally picked up that he was having some sort of pain and sent him immediately to the ER and he was having a massive heart attack. So for him, he dealt with it by avoiding that stressor. It was just easier to just not say anything to anybody. And then he thought he'd just die because it was cancer. And turns out that, it wasn't. He was having a heart attack and it could be fixed. Some more on adaptations. So it's a possible desired outcome of stress. It involves adjusting to the stress or stressor and allows for normal growth and development, and effective responses to life challenges. So, like I said, there's different developmental stressors, and that's normal. That's completely normal to go through different stressors at different stages in life, and it'll help you to grow to get through those. So, the ability to adapt depends on the intensity of the stressor, the effectiveness of the coping skills the person has, and personal factors. Have they been through things before? So everybody's different. Everybody has a certain tipping point, and everybody has a different point that they can handle so much. All right, so let's look at factors that influence adaptation. Say personal perception of a stressor, and be realistic or exaggerated. Is understanding of a stressor realistic? How successful have previous adaptation attempts been for this person? Okay, so the perception is another thing that we look at. So their health status. Is it constructive adaptive behaviors or diet exercise that are helping? Okay. So is it something that they think is helping them and it's really not? So the number of illnesses present and the chronicity of the illness may affect the ability to adapt to new stressors. So if I have cancer and I'm going through treatments and I'm already not feeling well and worrying about trying to overcome the cancer and now I lose my job, okay? That may be an extra thing that makes it so I can't overcome it and may lead to more illnesses, okay? Other factors that influence adaptation. So support system. A good support system can help someone to adapt. So it can help them through lots of things. Hardiness, we kind of already talked about. You can thrive despite overwhelming stressors. They again have commitment, control, and a challenge that they go through. Again, sometimes we call that grit. You may hear that term used here on campus. Personal factors can also have an influence on adaptation. So age, developmental level, life experiences, like we said, those all have effects. And that, like I said, everyone has a breaking point when stress then becomes overwhelming and then they feel like they can't do it anymore. Physical responses to stressors. So we're going to look at the general adaptation syndrome, sometimes known as GAS. Seeley's theoretical model of psychological responses to stress is part of that. It's nonspecific bodily responses shared by all people. That can be a response to distress as well as eustress. And it has 3 different stages. So it's got an alarm stage, a resistance or an adaptation stage, and then the recovery or the exhaustion stage. So let's talk about this first stage. The first stage is the alarm stage. It's the fight or flight. So running away from that bear, okay? And it involves involuntary body responses. So a lot of times it involves the endocrine system where the corticotropin releasing hormone and the adrenocorticotropin hormone and antidiuretic hormone all come together and have an effect on the endocrine system, which increases the use of fats and proteins for energy and conserves glucose for use by the brain. And anti-inflammatory effects can occur. And aldosterone in ADH has fluid retention. So when you think back to your pharmacology, wherever sodium goes, water will follow. So that, as a result, will increase blood pressure, even though we already know that blood pressure increases with the sympathetic system. Okay, so sympathetic nervous system, we get epinephrine, norepinephrine, and we get increased alertness. Cardiovascular system, we increase that heart rate and blood pressure. The respiratory system, the bronchioles dilate, so that way we can get enough oxygen in our body so we can run away from that bear. A metabolic rate increases. The liver converts glycogen into glucose for energy, so we have energy to run away from the bear. Urinary, blood flow to the kidneys decrease and retain more sodium and water, and renin secreted by the kidneys then produces angiotensin, which then constricts the arteries and tends to increase blood pressure. Gastrointestinal, we have peristalsis and secretions decrease. And musculoskeletal, the blood vessels dilate, increasing oxygen and energy to skeletal muscles. So again, so we can run away from that bear. Then we finally have that resistance stage or the adaptation stage. So our goal here is to have maintenance of homeostasis by basically coping or protecting yourself against the stressor. So it involves the use of coping mechanisms. It can be psychological or physical, which is like return of vital signs to normal instead of having that high blood pressure and heart rate. Now your vitals are normal. Or at this point, we can fail to adapt or contain stress leads to the third phase. If we don't adapt and it continues or gets worse, we can move on to the third phase, which is exhaustion. So if those adaptive mechanisms become ineffective or non-existent, our energy is depleted because we can't run away from that bear forever, and the body is unable to defend itself. We then get a decreased blood pressure, an elevated pulse, respiration, usually ends in injury, essentially, illness or death, this phase does. And then if it doesn't end in illness, injury, or death, we could actually end up in the recovery phase, okay, if the third stage of adaptation is successful. So it can go one of two ways. Either you're going to recover or it's not so good as far as an outlook for you. All right, then we have our local adaptation syndrome. So it's a response to stress involving specific body parts, tissues, or organs. It's a short-term attempt to restore homeostasis. It's localized, and there's a few different types. So there's the reflex pain response, which is protective involuntary response, such as withdrawing your hand from a source of pain. When you put your hand like on a hot stove, you move it immediately because it's hot. And then there's the inflammatory response, which is a local reaction to cell injury that protects the body from infection and promotes healing. Like when you slam your finger in the door, you don't have an infection, but it does swell and it hurts. You can feel your pulse in your finger. So that's an example of the inflammatory response, that swelling that occurs. Psychological responses to stress. These include feelings, thoughts, and behaviors. So we may have anxiety, which is an uneasy feeling of discomfort or dread, apprehension caused by the anticipation of danger, but not in response to actual danger. So anxiety is just anticipating that danger. Fear is a feeling of apprehension or dread from actual danger, threat, or pain. And then we have an ego defense mechanism, which would be like a denial, a rationalization, or projection. And then we have anger, animosity, hostility, displeasure, and then depression. So some spiritual responses to stress. These may vary among individuals. They may have a higher power or religious community for support. Someone may be searching for a larger meaning as to why did this all happen? You know, what's the big picture here? Some people view it as a test or punishment or challenge, like because I didn't give money to my local charity, now I have cancer, something to that effect. It varies in different stages of stress. So again, the alarm, adaptation, exhaustion, or recovery. Consequences of that failed adaptation, we kind of talked about a little bit, but we can get stress-induced organic responses. We can get continual stress, repeated CNS stimulation, so running away from that bear, elevation of certain hormones, and results in long-term changes in the body. So the body actually will start to change based upon what it's been, I guess, exposed to. It ages you. really is a lot of what it does too. Ages you pretty quickly. All right, so continuing on the consequences of failed adaptation. So you can end up with somatoform disorders, which are physical symptoms with no known organic cause. My big toe hurts, but there's no reason why. Hypochondriasis is abnormally concerned with his health or her health and interprets real or imagined symptoms unrealistic, fearing that they'll get worse. Somatization, it's a disorder. It's got anxiety, emotions are expressed in physical symptoms, loss of physical function, pain that moves. So they may not be able to use that right arm all of a sudden. No rationale, no reasons why. And then all of a sudden they'll be able to use it and now it's their left arm. Uh, somatoform pain disorder, which is emotional pain that manifests physically. So now my big toe hurts because I'm not able to cope with my stress from my husband dying. My big toe hurts all the time now. Malingering, which is a conscious effort to use symptoms to escape unpleasant situations or gain something. Stress-induced psychological responses can be like crisis event in a life drastically changes the routine and is a threat to self, and usual coping is ineffective, resulting in high anxiety and the inability to function adequately for everyday events. Someone can get burnt out, so they can't cope effectively with physical and emotional demands of the workplace. A lot of times we see that burnout. Post-traumatic stress disorder, PTSD, severe anxiety following exposure to extreme psychological violence, trauma, or physical or emotional abuse that can occur as well. So those are all side effects of not being able to adapt. So how do we have um, stress reduction interventions? How do we help our patients? So we can have health promotion activities. We can promote adequate nutrition. We can help clients establish a routine that includes regular like exercise um, or maybe regular card playing or whatever it is to help them release. Now, we do know during exercise, though, that the brain releases endorphins, which give the feeling of well being. So, exercise is actually really good for someone to do. Okay. And we always want to teach a client the importance of getting enough sleep to feel rested. So, 7 to 8 hours of rest a day is ideal. We know that not everybody gets that, but it is ideal to help them feel good. Health promotions activities continued here. So we can continue to encourage our participation in leisure activities. Like I said, we can help clients to manage time if that's part of the problem, balance responsibilities if that's, again, part of why they're stressed, or prioritize tasks. They will feel more in control and less stressed if they can get themselves a little bit more organized, and they may need just a little bit of help to get there. We can advise clients to avoid maladaptive behaviors like the excess alcohol, caffeine, sweet smoking, or illicit drugs as well. So use of specific interventions to relieve anxiety. We can look at anger management, stress management techniques like meditation, biofeedback, Reiki, humor, things like that. We can change perception of self. So help the clients to recognize their negative focus and to restructure their thinking in more positive and realistic ways. And then finally, we can help them by changing their perception of the stressor, and maybe seeing the positive side of something, identify and use support systems, reduce stress of hospitalizations if this hospitalization is stressing them out, use of spiritual support if they're very, very spiritual. We can use crisis intervention, or we can use proper referrals depending on what kind of referrals they need. So that's it for this PowerPoint slide.